Hi, my name is Dr. Barry Treisman, and today we're going to talk about back braces. And this is part of my Stop Back Pain University online course and is one of the educational modules. More information can be found about it at truckeychiropractor.com under the Stop Back Pain Resources tab. So we're going to talk about back braces, and you'll be able to make a better, more informed decision about what and how to use a back brace and where it's applicable, where it's not applicable. So back braces are going to be good for problems like disc, sciatica, osteoarthritis, spondylolisthesis, back strains, and generalized alignment. Contraindications are going to be cardiovascular disease, hypertension, and open wounds. And the reason that hypertension and cardiovascular disease are going to be problematic is that the brace is going to tend to increase intra-abdominal pressure, and you just need to get that okayed by your doctor, and it should be good. So how do you choose a brace? So I've brought out two today, and what you want to do is you want to find a brace that comes in multiple sizes. The brace should also have mechanical advantage straps so you can make it tighter and be able to give yourself some more stabilization. You need to place it properly on your body, and we're going to talk about where it should go. And then front and back panels for added support. And when you change your body position, you do want to adjust the tension of both the main strap and the stabilization advantage straps. And in general, lying down is going to decrease your abdominal volume, so it will become loosest when you're laying down, so you just need to be aware of that when you do adjust it. So first brace we're going to talk about today is the Core Fit Advantage AP brace, and I like it because it does fulfill all those requirements. So we'll take it out of the package here, and then we're going to put it on. So first I got to get the Velcro off, and the Velcro is really burly and nice. And then what you see here is that this back brace here will adjust to going up and down depending on your body size and where your problem is. And there's a Velcro that does that. And then if you look here, there is this additional stabilization panel that fits on the inside. And then when it comes to which side you want to put on, one of the things that you want to do is you want to make sure that their label is on the correct side, and that way you can make sure that you're putting it the right side up. Where you put it is going to be important. Let me go back. So in addition to those, you can see here that it has these reinforcing stabilization straps, so you can leverage yourself and get some more tightness. And it also has the strap here and the strap here so that you can more easily get it tight. So you want to measure just below the waistline, kind of above your hips, kind of here is where you want to measure it. And there's 6 different sizes, and so it can fit from someone who's taller to someone who's smaller. And that's an important thing. The other one that I'll show you in a little while is a one-size-fits-all, so it's not going to fit and give as much support. Here's the other one, the Ace Bandage one. And so what you have here is you have the strap, and it's going to go on like that. So let me put it on. And tighten it. And then I have these additional tighteners like that. And it certainly makes things more stable, but it's a step below the Core Fit one. So let's get to some mechanical things. So our belly button is at the L4 disc space. And when it comes to problems, people most commonly have L4 and L5 disc problems. That's over 90% of the disc problems. So that's really what we're focused on here. If you kind of put your hand on the side of your leg here, you're going to feel a bony prominence. And we call that bony prominence the greater trochanter. And that bony protrusion, the greater trochanter, is at the same level of the coccyx. And the coccyx is where the bottom of the core-fit brace should be. And to find the coccyx, another way is that if you find your butt crack and you kind of palpate and you're going to feel a hard bone underneath the skin, and if you just come down low enough, it's going to disappear. And right where it disappears, that's where the coccyx ends and where you're going to want to have that brace. But the easier way to find that, I think for most people, is to find the greater trochanter. And that's going to be the better way to do it. So let's put it on. So like I said, you're going to want to have it so that the label is upright. And then you see here, the right hand has this nice little loop that your fingers can fit in. And then the left hand has a pocket here that it fits in. And so what that gives you the ability to do is you put the left hand down and then you're able to wrap the right hand around and get a really nice snug initial fit. And then we can use these leverage straps, and if I want the bottom one here is tightened and then the upper one here is tightened, and then I wrap around and tighten those guys. And now I have a really nice amount of support, and this is definitely a great brace. Once the brace is on, one of the things that you want to make sure is that if you bend your hip, it doesn't interfere with your hip motion, because if it does, it's going to tend to limit the hip motion, and that's going to put more pressure on our lumbar spine and our spine in general. And we don't want to do that. And we want to have a neutral spine position and maintain that neutral spine position, because that neutral spine position is going to be what is going to let us heal and make the back stronger. The more that we get out of that neutral spine position, the more irritated we're going to be. And if you go look at my alignment and stabilization video, I will go in depth into how to do that using your own body, muscles, and neurological stabilization system. And that's one of the most important things that we can do. The brace does need to be worn at night, because one of the things that we do is we often injure ourselves at night. We get those little tweaks, and sometimes we feel them and sometimes we don't. And in general, at night, we are more likely to get those little twinges. It's one of the reasons why when we wake up in the morning, we're going to be more stiff. There's also going to be an increase in inflammation when we stay still for a while. So movement and ice and doing other anti-inflammatory things is going to be really important. But when we are injured, our body's ability to control is decreased. And as we get better and heal, we get more and more of that, and we'll need less of this stabilization belt in the future. So I talked about inflammation. I have a great video that explains about how to decrease inflammation and using ice. And the reason that I'm such a fan of ice is that it has very few side effects. And not that the anti-inflammatory drugs and anti-inflammatory supplements are not going to be great and important, but the first line should be using ice. So this brace is called the CoreFit Advantage AP Lumbosacral Spinal Support. I am going to add a link down in the description if you want to go ahead and buy it. I do want to thank you for listening to me and hope you've gotten a better understanding of what and how and when to use a brace. If you could reach down there, or I guess is it here? Yeah, reach down here and subscribe. That would be awesome. Or give me a thumbs up, or add a comment, and I will respond to your comments. You can also call me or go to the website and find me via the contact form. And there are more resources on my website, truckeychiropractor.com. And specifically to the Stop Back Pain University and the online course, there is a separate tab, and you can find a ton of information there, slides for each of the presentations, handouts, and videos, and we'll just keep adding more and more videos until this is the most comprehensive stop back pain location in the world. Thanks.